Welcome to the second part of respiratory system. Today we are going to discuss about paranasal air sinuses and sinusitis. So, what are sinuses? Sinuses are air-filled chambers of the skull which are lined by a thin mucosa, that is ciliated pseudostratified columnar epithelium. There are four types of sinuses. First one is frontal sinus, which is situated in the frontal bone. Next is ethmoidal air sinus, which is situated in the ethmoid bone. Maxillary sinus, it is the largest among all the sinuses, situated in the maxilla. And the sphenoidal sinus, situated in the sphenoid bone. Please note down carefully that the maxillary sinus is the largest. Do you know that sinuses are absent or rudimentary at birth? And at birth only two sinuses, maxillary and ethmoidal sinus, are present. The sinus attain full size after the puberty. The function of paranasal sinuses. At first, they humidify and warm the air which is inspired by the nasal cavity. Next, they maintain the pressure of the nasal cavity. They lighten the area of the skull or the weight of the skull. As because they are filled with air, so they help in the resonance while producing voice. Next, they absorb the shock as because they are filled with air and also contribute to facial growth. Normally, the sinuses are filled with air, but when any type of virus or bacteria affects the sinus cavity, excess amount of mucus is formed, and this condition is known as sinusitis. Most often, the rhinovirus affects the sinuses, so it is also called as rhinosinusitis. Rhinosinusitis is a condition where the air spaces become covered with the mucus filled spaces, so that excess amount of nasal mucus is formed and they become made a plug into the nasal cavity, so that the person is unable to breathe. There is also facial pain, as because it is an infection, it causes a fever and headache also. Thank you for watching this video. If it is helpful to you, then don't forget to like, share and subscribe my channel Untu's Creation.